start from the beginning, from getting the scope. So in theory, everything that we do in GI and endoscopy and cardiology and bronchoscopy is in these guidelines. I have this book. It's available to anybody that wants to read it. Everything that I will talk about or do is all about the scope, the storage, and the cleaning, and I only go by these guidelines. I never vary from these. These are what I say when Joint Commission comes. This is why we score so high, and this is how we will always follow. So you should never in your life ever know what a scope feels like. Never. You should never know what it feels like, and you should never have touched a scope bare hand for anything. Scopes are never touched barehanded, ever. So the first thing you would do when you come in is you're either going to wash your hands or you're going to gel immediately. You will have your packaging. If respiratory comes, if for the TE scopes from cardiology, they bring their packaging. GI has their packaging there. However you're going to come, you need to come with a package to take your scope. You will glove up. You will go to our cabinet. This is the bronchoscopy and anesthesia side of the cabinets. You will choose your scope. You will check to make sure it is not expired. These are the tags. These tags say when it was washed, that it went through all of the guidelines, that it was disinfected and passed. It is highlighted, and then the expiration date is written at the top. You will take your scope out of the cabinet, whichever one you choose. You will close the cabinet, and you will package it however you need to package it. Okay. You will take it to wherever you are going to perform your bronchoscopy. You will set up your pack. Our packs are green. I noticed that respiratory sends blue packs. Every pack should have a water container, a sponge, and a brush. The only thing that needs to come back with the scope is the brush. It will be brushed in the sink. It also has a biohazard sticker that goes on after it is packed up and placed on top. Bronchoscopy scopes are 180s. That means that the electrical is exposed. 190 scopes, which you may have one of in there, does not have an electrical exposure. This is extremely delicate. This should never be touched with water, the hand, or anything else except a cap and this. These are prongs in here that are very delicate and break easily. So this should always be examined to make sure there's nothing in there, no debris, no moisture, anything at all. It would be plugged in immediately and then capped immediately by this. The same is going to happen when it comes out. The caps are all kept in here. Everybody is welcome to this room. This is the authorized personnel only. Everybody that works is authorized to come in here. All of our caps are kept in this drawer right here. It is marked scope cards and caps. There is plenty to go around. You're welcome to take them, keep them in your department, but they need to be cleaned and make sure that they are dry of all debris. So ERCP scopes used to have these. We don't use these anymore, so we have plenty for everybody. Your EBUS scopes, you will need 2 of these. So when you take an EBUS scope, there's 2 caps. You'll have to cap both sides. So you take this, you put it up top wherever you can keep it dry and clean. A lot of people do this, whatever, but it needs to never get moisture in it, so it's kept up there. So this is your complete setup. Once you do the bronchoscopy, everything is on the tower. You have your air on, you have your lamp on, perform the bronchoscopy, and you're done. Once you are done, you want to turn off the lamp. The lamp battery is down here and it burns bright, and it's a very difficult process to change, so we try to savor the lamp. So we turn the lamp off, we keep the suction on, and you'll keep your air on. Once you're done, you will have a sponge. I believe your sponge is blue. You're gonna take the sponge out, and inside every sponge is an enzymatic. This breaks down protein. How we contaminate patients is protein. This breaks it down. So you're going to take your sponge and you're going to put it in minimum 500 milliliters of water, minimum. You're going to take your thumb and you're going to expel that enzymatic into the water. It is a low suds, so you're not going to get a lot of foam, but you're just going to do this. Once it starts to come out, you squeeze it, give it a couple more, squeeze it again, and then you have a nice wet sponge with some enzymatic. The entire scope gets cleaned. You start at the top, wiping wherever the hands were. You go all the way down here, going back and forth. Once you reach here, you're going to put it inside of the enzymatic and you're going to do one swift wipe. All the way, you're going to take the tip, gently put it inside and twist. That gets all the external debris off. When that is done, you're going to take your scope, put it inside, and you're going to suck for a minimum of 10 seconds or 500 mils, whichever comes first. It's based on how much debris is inside of your scope from the procedure or how high your suction is. So that's only 100 mils down. 10 seconds is quite long. It's longer than you think. It's sucked all the way to the end. It cannot hurt it. It will only help get the protein out and the debris. Once you have sucked all of that for 10 seconds, we're going to place it there. You can suck the remaining out with the suction from the top. You will remove all disposable buttons from the scope. I'm going to save this for future. You will dispose of this, your sponge, and this. None of this will return with us. We don't want any of this. You will undo your scope here from the cap. And the first thing before you do anything is to protect this. You will take your cap, you'll place it on, you'll do a turn, it locks. You'll wrap. You'll send this. You'll cinch your bag. You will take your biohazard sticker, peel it, place it on the outside, and put this inside of your container and transport it to us where we will process it and put it back in the cabinet for further use.
Fantastic.
We need 2 stickers from the patient, one for the paper that is sent, and one for us to scan for the processing of the scope, because every single scope is matched to a person that processed it, who brought it, and who the patient was, and at what time it was done, because it has to be done within 1 hour. So that it's processed within 1 hour. If we do not receive the scope within 1 hour, it has to go through an extended soak. It is extremely hard on the scope. And it's extremely hard on the staff because we do have limited staff. So the hour is imperative that we get that scope back. Also, protein starts to get into the scope and it's much harder to get out. And that's it.